Upon his first day in office, U.S. President Donald Trump sought to make some much-needed radical changes for the betterment of his country. One of the more shocking itineraries on his agenda was the departure from the World Health Organization. The outrageous headline circulated on various online forums has since just been confirmed by the World Health Organization themselves, stating that the United States is set to officially withdraw from the WHO in January 2026, following a formal letter from the president himself. The U.S. contributes about 18% of the organization's funding, which amounted to around $261 million between 2024 and 2025. The president has vowed to end future funding. This drastic pay cut will negatively impact countries heavily dependent on WHO funding. Millennium Heights Medical Complex Chief Executive Officer Dr. Damian Greaves is of that opinion.
We signed the executive order, and the United States contributes to the World Health Organization $500 million US. And he spoke about China contributing just $39 million US. If that money is withdrawn, we can understand the implications. The WHO is an organization that looks after our policies, world policies, very instrumental in terms of tracking our infectious diseases, chronic diseases as well. But you know the role that it played during COVID and the role that it's playing now in terms of the MHPV or MPHV vaccine. So it's playing a role in this new vaccine now. Can you imagine if that money is withdrawn, the pressure it will place on small countries like ours that would have to navigate? Because as you know, the United States has been leading in several areas and not just financially. And if that pullout comes, we can well imagine the huge gap that would be left, and we therefore have to come together very quickly to see how we can navigate, even as WHO may be in fact thinking of how they can deal with this situation. It's incumbent on us for us to also begin to look at those kinds of situations.
The island's health minister, Honorable Moses Jean-Baptiste, is also wary of what this move can mean for the already struggling healthcare system of small island developing states like Saint Lucia.
Well, clearly some of the programs that are being run by the World Health Organization obviously receive funding from more developed economies like the United States of America. So funding will certainly be an issue. However, the Caribbean region, I'm sure, will prepare for a time, if this really happens, to have our programs either augmented or to seek alternative forms of funding. But yes, it will have an impact on a number of programs, not only in the Caribbean, but throughout the world.
As such, Dr. Greaves stresses the importance of remaining proactive with such a heavy threat looming over global healthcare.
So I believe that it is incumbent on me now as the CEO of this hospital to begin to think of how we can look at that, and for the Ministry of Health to begin to look at that, and for CARPHA in Trinidad and Tobago, the Caribbean Public Health Agency, to begin to look at that and anticipate what that shortfall could mean in terms of our onward march in regard to the health outcomes of the region.
He stresses the need for an integrated approach to rectify healthcare challenges.
We need to begin to put things in place. So even me here at the WHO, at the Millennium Heights Medical Complex, I've already spoken to my senior management team that we need to begin to think of this, because we have to engage in some measure of analytical engagement, but also we have to look at what I call strategic foresight as to how we can navigate in the absence of that pullout.
President Trump has since recalled all U.S. government personnel working with the WHO and ordered them to cease participating in negotiations on a WHO-led global treaty on dealing with pandemics. The loss of the top donor will impact the Global Health Agency's ability to address major crises from tuberculosis to HIV or AIDS and global pandemics. The World Health Organization expressed regret for the announced departure and expressed hope for consecutive dialogue to maintain the partnership between the USA and the World Health Organization. The U.S. joined the WHO in 1948 through joint resolutions from both congressional houses, leaving a question mark over whether Trump can unilaterally pull U.S. membership without congressional approval. For Choice News Now, I am Chelsea Austinay.